Hey, it's Amy Shaw here. I have something specific on my mind today, although I'm probably going to ramble a little bit today as I did in my video yesterday. But this came up for me. I have a subscriber to my channel who occasionally likes to leave comments. Such a lovely soul. And this soul doesn't necessarily leave very nice comments. The last one that was left for me was a couple of videos ago, and basically it was sort of trying to fat shame me, make fun of me for being fat. It was a comment about my neck, and it's an interesting thing, so that's really what I want to talk about today. I want to talk about my cancer and my health, and I'm feeling pretty magical today. So I thought that I would get in front of the camera and share with you. So the comment about my neck was really curious because about 2 months ago, I woke up one day and I lost complete range of motion and functionality in my left arm. And I wasn't really sure what happened. Did I injure myself? I don't know, because quite frankly, I'm not in my body a lot of the times. And so if I injure myself, I don't always even know until like the next day. I have bruises all over me. That's another thing, is I'm starting to bruise really easy. And I have no idea where they came from, how I got them. So I did have a bruise, a pretty nasty bruise on my arm. I don't really know how I got it. But I had no functionality in my arm. I literally could not even move it in certain directions. And the other thing that happened is I started noticing swelling here in my neck. And when I pressed on it, it would send like this shooting pain down my arm. Well, so it's curious because, and I'm gonna really get into my health and things I've been through. It's actually just the tip of the iceberg, but I'm gonna give you a little tip of that iceberg. So if you're not interested in hearing me talk about how I healed from stage 4 cancer, you can just shut the video off now, because I'm gonna get into it. So I had cancer actually. In my original cancer was on my right side. So I had inflammatory breast cancer, so I never had actually a lump. That's a whole different topic, but I had cancer all in my lymph nodes in my armpit. So I had to have a radical, meaning they took lymph nodes out, modified mastectomy bilateral. So I no longer have breasts. And when my cancer metastasized, one of the places of the several that it went to was actually my left side lymph nodes in my neck. Prior to that, like the month prior to my scheduled mastectomy, because I had to have lots of chemotherapy first before I could even be a candidate for the mastectomy. So I was having chemotherapy. I had 2 more treatments to go before I was scheduled for surgery. So this was October 2003. I got a blood clot actually in my jugular vein in my neck. Usually they put the portacath on the opposite side of the cancer. So because my cancer was on the right side, I had my portacath on my left side and sewn into my jugular vein here. But I got a blood clot, and it completely clotted my jugular vein in my neck. I almost died from that. I mean, it was horrible. I won't go into the details of it, but it was horrible, incredibly painful, and part of it broke off and went into my lungs, so I had pulmonary embolism. It was just really a shitty experience, and I almost died from it. So they had to take the portacath out, and they put one in on the other side. And actually, the portacath that I have now, if you can see it, and it's sewed in right here, again, into my jugular vein on my right side. And this one I've had since 2006. It's actually my 4th portacath. So I got this blood clot in my neck, and it caused my body to develop collateral veins. The body is so amazing and miraculous, right? That it just compensates and fixes itself. So my body developed all these sort of like collateral veins, and they're gross, they're like snaky, and just they're nasty. But it kept me alive. It kept the blood flowing out from my head back to my heart in the way that it's supposed to. So my body did its job, and I got new collaterals. And when I went to go have another portacath put in, I had 6 surgeries in 12 months, you guys. 6 surgeries in 12 months. That's no joke. So, like, I begged my surgeon, please, please don't, when my cancer came back and I had to go back in and get another portacath, please don't make me go under anesthesia. And he was like, no, you really need to. Trust me, you really need to. And I just begged him, no. The thing about anesthesia is it's trauma. It traumatizes your etheric and your astral bodies. You know, I remember the last thing my surgeon said to me before one of my surgeries was sweet dreams. And as they're putting the mask over me, I said, you don't fucking dream. I was so angry, you know, and when I came out of that and went to the follow-up appointment, I asked him, hey, doctor, surgeon, have you ever had surgery? And he says, no, I haven't, but I know where you're going with this. Yeah, exactly. So I told him, please don't tell people sweet dreams, because the stuff that they give you, you don't dream. It's so traumatic for the body. It really is. So I had been through enough trauma. 6 times in 12 months was enough. Not to mention the chemotherapies, the radiation, everything that I had gone through was enough. I had tons of complications from surgery, and I mean, I won't even go into all that. I'm just giving you the tip of the iceberg of what I've been through. But I was repeatedly in the hospital and almost died, you know, I went through a lot. So when my cancer came back and they said, okay, we have to put another portacath in, I was like, please don't give me anesthesia. And he really didn't want to do it, but he agreed to do it. So I went into literally to the operating room with no anesthetic but local, while he tried to put a portacath there in my neck. And you probably can't even really see the scar that good, but it's a nasty scar right here. And I was awake for that whole thing as he was trying to stick it in. The vein was still occluded from the clot, so he couldn't get it in there. So I'm laying there as he's like fishing this thing up into my jugular vein, trying to get it. I'm bleeding out literally all over the back of my head. I'm feeling it, like the whole back of my head's filling up with blood. And I'm watching my surgeon, and he's like panicked. He's like in a panic. He is like, and at some point I obviously stopped breathing because the anesthesiologist who was standing behind me, like monitoring my blood pressure and my oxygen level, started yelling at me, breathe, Amy, breathe. It was probably, that moment was just terrifying. Like to see my surgeon like lose his shit while this is, it was scary. I wouldn't recommend trying to go and have any type of surgical procedure while you're not on anesthetic. But that's me. I had to tough it out, you know, and I'm glad that I did that. It showed me what I really am made of, and I just didn't want to go under the anesthesia. I just didn't want the trauma of that. So anyway, that was that story of that. But one of the places that my cancer came back was actually in the lymph nodes in my neck, which is a curious thing because my cancer was on this side and here it is over here in my neck. The lymph nodes in your neck drain your head. So even though my CT scans and my PET scans never showed cancer anywhere in my head, just in my neck, the fact of it is it's circulating somewhere in my body and was in my head to end up in the lymph nodes in my neck. So I had been having this symptom of this swelling here for several weeks. At the time I had lymphedema, I still have lymphedema, so I was going through lymphedema therapy. And my lymphedema therapist, I pointed it out to her, and she was so concerned that right then and there, she walked over to my oncologist's office, because it was all in the same building, a comprehensive cancer center. And she was like, something's going on. We need to get her scanned right away. Well, you know, to make a long story short, they did an ultrasound, didn't see anything. Did a CT scan, didn't see anything. Well, guess what? The lymph nodes were full of cancer, and that's why I had swelling there. But it wasn't until I had a CT scan later that was like my whole body, like my normal post, chemo whole body scan, that they saw tumors elsewhere, and then they did a PET scan at that point. The PET scan is what lit up and showed that there was activity going on. So I went to MD Anderson in Houston, and they did a fine needle aspiration where they stuck the needles into the lymph nodes using an ultrasound and extracted it. And I waited there on the table, and 15 minutes later they came back saying, yes, it was cancer. That's a curious story because that was the first time ever that I had a doctor. I was alone in the room with him, in the ultrasound room, pretty much naked from the waist up. And I don't have breasts, but I had, my tattoo. And he was actually like asking to take pictures of my tattoo. So here I am alone at MD Anderson in this office with this doctor who's pulling out his phone asking to photograph me. Like, talk about bizarre. It was really bizarre. That's just a fun little story. I got lots and lots of fun little stories like that. 14 years in cancer treatment. Trust me, I have stories. But the point of it is that I've had stuff going on in my neck repeatedly. Blood clots, cancer, I mean, you name it. So a couple months ago, I started having this arm problem and I started noticing this swelling in my neck. And when I got my blood clot, my whole entire neck swelled up like a football player. Oh, it was an awful thing to go through, you guys. It was awful. Like, my whole arm turned purple and I was vomiting uncontrollably. I couldn't stop, and then I couldn't breathe. And I mean, just the whole experience was horrible. I don't wish it on anybody. So the neck swelling. So I went to my oncologist right away and I said, I'm not really sure what's going on, but I have something's wrong with my arm and my neck. And so, when I push on it, the pain and like the whole thing. So they were like, okay, let's do a CT scan. So they went and they did a CT scan and no, you don't have any cancer. See, you're fine. Go away. Well, I had a CT scan before when I had cancer in my neck and it didn't show. So I'm not impressed with their ability to see anything because they really can't see. I knew something was wrong with my body. I couldn't even put clothes on. Like, I couldn't even lift my arm up to get a shirt over my head. I mean, it was so bad. And the pain, I couldn't sleep on that side. And it just, yeah. So 2 months later, my arm, I finally have regained mobility in it, but I do still notice, even most especially actually when I'm making videos, I notice there's still swelling in my neck. So I don't really know what that's about. It's like undiagnosed. And when you've been doing this for 14 years, you come to just accept and understand that our medical system sucks and they're not good at really diagnosing things and helping people. So I've really learned to sort of diagnose and treat and heal myself in other ways and to not rely on them. They wanted to send me for an MRI, but I don't want an MRI. I just didn't want to keep going through that. By the time they offered that to me, I was starting to see improvement in my arm, and now my arm doesn't even hurt at all. So I have no idea if it was an injury or what it was. But the point of it is I am still having swelling in my neck, and I have gained weight. I have probably gained about 15 pounds as well. Part of that has to do with the mold allergy that I just made a video about yesterday, and a lot of other factors too, just things going on with me physically. My physical health is something I have to tend to every single day. 14 years I've been in cancer treatment. And, my body is, I was 30 years old when I was diagnosed. I had breasts, I had ovaries, I had really thick hair, and 14 years of cancer treatment. I've had enough steroids, you guys, to probably kill a racehorse. That's no joke, because your body rejects the chemotherapy, and so to prevent the body from rejecting the chemotherapy, they have to dose you up with all kinds of other stuff. Steroids and antihistamines, and then on top of that you get anti-nausea meds, and you just get, it's like a medication festival that happens. And, all of this alters your body. I've had my immune system literally reset so many times I can't count. And by reset, I mean they plummet you down to like 0 immune system, 0 white blood cells, 0, 0, 0. And I'm telling you, in 14 years, I've met literally hundreds of people in cancer centers all over the place. I've been to City of Hope. I've been to Arlington Cancer Center. I've been to MD Anderson multiple times. Austin Cancer Center, multiple locations for them. I've been, treated the longest period of time at Comprehensive Blood and Cancer Center. So I have been to multiple cancer centers across all sorts of different places, and I've met hundreds of cancer patients with all different kinds of cancer. And I'm telling you, a lot of people still are dying of cancer. And I'm telling you, the people that have the type of cancer I have, which is extremely aggressive, aren't living. They're not living. They're still out there dying. Even in my little local circle of metastatic women with metastatic just breast cancer, not even inflammatory breast cancer, just breast cancer, they are dying as they're in treatment, as they're getting treatment, okay? So treatment is not a cure. It's not curing women. They're progressing while they're on treatment, okay? The other thing about that is that I have also personally known women who have been in treatment and who have literally died from the treatment. And I'm not joking. You know, whether that's like complications, the liver toxicity, they had liver failure, or they became neutropenic, you know, meaning that their white blood cells got too low and then they caught infection and died from that. So the point that I really want to stress today is that people die even when they're in cancer treatment, and some of them even die from cancer treatment. So if it isn't the cancer that's killing you, it's potentially their poisons in their treatments as well. And I've had it all. I've had 19 chemotherapy treatments, and I'm talking aggressive chemotherapy, like multiple drugs, not just one drug, multiple drugs. You know, I've had radiation, you know, 35 daily, every day I had to go to, and to the point where I had open blisters on my skin. I could just go on and on and on about what I've been through in this 14 years and the degree of like all of that, the complications. It's been a lot, okay? And one thing I've learned, I am in a survivor category that's less than 1%. What I'm telling you is that women that get diagnosed with stage 3C inflammatory breast cancer, as I had, who had a metastatic recurrence to distant organs, there's less than 1% of us that are still living at 14 years out. So when people talk about healing, look, you're looking at it. If you want to say to me, well, that's just luck, or, you know, that's because you responded well to treatment, or, you know, what have you, you can, you know, believe what you want. I know what I believe because I've put in the work. I've been there. I've been the one that's been doing the work. So the one thing I really want to impress, I think, on you today is that you can heal. It is possible, but it's not a miracle in the sense like it just happens to us and we don't know it happens. At least that's not how it happened for me. I might have difficulty articulating for you all the ways, but I can tell you this, that I put in the work. I put in the work, and I decided I was going to heal. And in that sense, my cancer did sort of serve as an initiatory experience into the higher healing arts. So I can't really pin the whole thing on the treatment approach that I chose, when I know on the back end I was doing the alchemical work in clearing and healing myself and my body. So when you come at me with these comments about I'm fat and making fun of my neck, in the context of who I am, I mean, I have no breasts, I have no ovaries, I have no uterus, my hair is totally thinned out, I've lost it completely. Eyelashes and eyebrows as well, 3 different times. I was put in menopause at 30 years old from chemotherapy. You know, I have scars literally head to toe. I have another scar right here. I don't even know if you can see it. That was from a biopsy. I mean, my whole body is just like one giant experiment of how to stay alive. So there's nothing you can really say to me at this point that's going to make me feel ashamed of my body. You know, I go through periods with my body that are tougher than others, but for the most part, I'm pretty dang strong. You know, I've come through a lot, and I'm going to be 45 this year, diagnosed when I was 30. Yeah, I'm okay. I'm great with where I'm at. So have a magical day. I love you guys so much.